I know that Africans Rising is not shy about calling out these uncomfortable truths. And I know that you have worked on a lot of youth-centered projects, gender-centered projects. Desta brings up the fact that women have borne the brunt of this pandemic for the most part, being part of the informal economic sector, also taking the burden of care and maybe not having the decision-making power, to go and stand in line for 4 hours to wait for a vaccine when you need to take care of your family at home. So what is Africans Rising kind of thinking will be a mechanism to deal with these populations who, even in the countries where we do have some vaccines, are not able to access them? What are some uncomfortable truths that Africans Rising has had to raise at country level?
Thank you so much. I think our members have been, very much on this campaign called Rise for Our Lives, where they are reaching out to governments, engaging governments at all levels, but also engaging communities to really come together and sensitize them as themselves, but also to collectively work together in different dockets, especially the women movements and youth movements have been very instrumental in this collective of a campaign where they're raising all the different type of issues. I talked about the follow the money, that how is the health money budget used on this whole issue of response to having the population vaccinated, but also having been providing the certain necessities. So communities, especially women, who are in the front line of feeding their family, but also taking care of the household, burden. So these are things that the movements on the ground have been working on, and we have been collectively supporting and amplifying their voices so that they can be heard, and have also been engaging a lot of government, high-level government officials in this crisis, so that they really understand and hear what the people are faced with. But I think for me, it's a continuous fight, because we know that our setup and our systems have been in a way that many of our government officials, if not all, have been living in a life of comfort, and they don't care much about the ordinary citizens. So that's why the ordinary citizens really need to get organized, especially in the face of women movements, in the face of youth movements, to really challenge the power. Because when women actually really organize themselves, that we work with, governments have been in response in many instances. So that organizing model and that organizing mood need to continue, because we have to hold governments accountable to deliver on the promise that they've made as they take power. And one thing that is clear is, if you don't feel it, it's difficult for you to act on it. And then these people are living in very comfortable life. They already got their vaccines, and they already got maybe their boosters already. They have gone to Europe and took these boosters already to save themselves. So they feel like they are not even part of the society. So if you do a research on how many health ministers or how many presidents have got the boosters, you will find out that maybe almost all of them in Africa got this. They have traveled for it, or they're almost about to travel for it. So we live in a society that is so unjust, and then most of the time the burden and the challenges, the brutal challenges taken by women and young people. So that's why they have to be supported by all different players in the space to be able to advance their agenda and their issues, so that we can confront the challenge holistically.